Hi YouTube. So you'll have to pardon, I'm drinking water, lots of it. It's my 3rd liter of the day. This week, today, I am 33 weeks and 1 day pregnant, and to quickly run through all the stuff I normally do, I've gained 10 pounds total. I think I was up to like 12 pounds before, but it's gone down, so who knows. Yeah, 10 pounds total. Baby is moving lots. I'm having a few contractions, but they're not crazy. They're just Braxton Hicks. This past week has been really, really rough because, as I said in my last video, we are putting our dog down on Friday, and we've been trying to spend lots of time with him and spoil him. He's just very old and he's in a lot of pain, and he's had a few things, like he's had a couple accidents in the house, and he's having trouble going up and down stairs now, and yeah, it's just been really rough to watch and really hard to make the decision because, of course, we still feel kind of guilty about it. The other reason that it's been kind of rough is because, and you'll have to pardon, this is not going to be a cheerful video, I'm afraid, is because we went for our ultrasound last Wednesday to ensure that the placenta, which had been low-lying in the anatomy scan, was moved up and out of the way. It's not. The baby is perfect and totally fine. The placenta is showing that it's low, so low that it's directly next to the os, the internal cervical opening, and so low and so close that the ultrasound tech was calling it a previa, meaning that it's covering the os, because she just can't be sure that it's not. I'm suspicious that it actually is. Like, I don't necessarily believe it is, for a couple of reasons. One is that I haven't had any bleeding. Usually with previa, if it covers the os, there's bleeding. I haven't had it. And the bleeding is usually kind of around week 25 to 28. The second reason that I'm a little bit suspicious is because the first ultrasound showed a low-lying placenta, and this one is showing one that's even lower, which is rare. Like, so rare it shouldn't happen, because if you think of it, placentas, the way they work is, if you take a balloon and you put a dot on it and then blow the balloon up, that's kind of how your uterus works, and that dot will move away from the very bottom. It'll move up the balloon as you're blowing. That's kind of how placentas work, because they implant in your lining, and then as your uterus expands, they move with your uterus. I've seen in a few places on the internet that some people have placentas that go lower, but it's pretty rare. Like, I've found a couple that were questionable. For those of you who don't know what previa is, it's where the placenta covers a portion or all of the cervix. It can mean that it's very, very dangerous to have a vaginal birth with placenta previa, because it can cause a placental abruption and can cause severe hemorrhaging in mum, which can cause death, maternal and fetal death. Not something I want. So usually the course of action with a previa is a cesarean section. I obviously do not want one. Cesareans and epidurals are my 2 biggest fears surrounding birth. And yeah, I don't want one. But if it's something that I don't have a choice in, like, obviously I have to get it done. What's going to happen is the midwives are going to be scheduling another ultrasound for not this Wednesday, but next Wednesday, probably, with a maternal fetal medicine specialist. it's essentially like the top tier. Like there's OBs and then there's MFMs, and yeah, these are people that are seriously good at what they do. So they'll take a look and see if it truly is a Previa. If it is, I'll still be requesting another ultrasound for 2 weeks from that date for roughly 36 to 37 weeks, because I'll be growing. It'll continue moving. The uterus will continue moving and expanding. So with little luck, even if it is a Previa, it'll still continue to move and eventually get the F out of the way. But we'll still have to book a section. If it gets to the point where I have to go in for a section, there will be an internal done. Like, we'll be asking for one when I'm in the operating room before the epidural line is placed. The reason for this is because my midwife has had 2 patients, totally different situations, but where they said that they had a Previa, and upon the internal examination, there was actually no placenta there. You have to do it in the operating room, though. You can't do it outside, because doing an internal exam and hitting a placenta can cause like major bleeding, and so you need to have like operating equipment right there, because if you start bleeding, it's time to get the baby out. I'm very frustrated with this whole situation because I'm so passionate about birth, and I'm so big on women being in control of their experience and having all the information and then acting on it. And at this point, it's like a cruel joke, because I'm just kind of along for the ride. Like, whatever these ultrasounds show is going to determine the rest of it. We had to tell my daughter that she might not be able to come to the birth, and that was hard, because she's been looking forward to it, and so have I. Anyway, obviously we're hoping that it's going to move. And if it doesn't, well, then it doesn't. Like, there's nothing I can do about it. In the meantime, I've been doing a lot of things that hopefully are going to help. I've been drinking lots and lots and lots and lots of water, because they say that the more water you drink, the more it increases your amniotic fluid, and there are studies that have shown that. I'm hoping that if I can really get amniotic fluid in there, that, like, I don't know, it'll stretch my cervix, or not my cervix, my uterus or something, and help stuff move out of the way. I've been doing a lot of squats, trying to encourage baby to go lower, because I've read of a few cases, and actually one article written by an OBGYN who said that, you know, the placenta is essentially a big bag of goo before it's born, and so if the baby is head down, which mine is, and is pressing on the big bag of goo, it can sometimes look lower than it actually is. So I'm hoping that if I can get baby to engage and pop below that lip of placenta, that it will show that the placenta is not as low as they thought. I've also still just been trying to eat really healthy and eat more, because I don't know, I'm hoping the baby will grow like a pound maybe before my next ultrasound, and will help stretch the uterus and, I don't know, make the placenta move. Yeah, so it's been kind of a bummer of a week, and I haven't been sleeping real well. I looked at the report last night, the ultrasound report, and sent an email to my midwife at like 12:40 in like a.m. and yeah, she called me this morning and was like, you need to sleep. Like, I don't want any more emails from you. 12:30. It's just been a lot of bad news in a really short period of time, and it's been hard to deal with. I don't handle stress well. Anyway, I did want to show you guys one thing that's really not sad. So, we went and bought the baby's homecoming outfit. We actually have two. This is the one that we have, and then the other one I'm just bringing like newborn preemie stuff because our daughter was 6 pounds when she was born, and if I have another small baby, like I'll need something small to bring them home in. So this is from H&M, and it's a teeny tiny little onesie. It's for a 1 to 2 month old, so I mean it's probably like an 8 pound onesie ish, but it's so cute. It says little froggy, and then it comes with pants, which are right here, and then a teeny little hat. So cute, right? Anyway, this is gonna be their homecoming outfit. Ooh, that eyeball doesn't want to stay up. It's kind of boyish, I know, but I really think I'm having a boy, because really giving me so many issues already. But yeah, H&M doesn't really have gender neutral stuff, so I kind of went with boy-ish. But I mean, the girl-ish stuff is like, it seems like everything girl is pink, 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 and frilly. And there's nothing that's like at all neutral about it. Like, no boy could wear it. Whereas, well, I suppose they could, but they'd look pretty girly. Whereas like boy stuff, you can kind of get away with it on a girl. So anyway, I'm going to ask that anyone who sees this, please get the F off Kayla's cervix vibes to my placenta. Bet you never thought anyone would ask you that. And yeah, send us some strength on Friday, because that's going to be a rough day. Saying goodbye to our boy. So anyway, that's it. And I hope that the next update at 34 weeks is going to be a little less depressing. I will do a bump shot just to show you. He's moving so much right now, it's crazy. It's probably the cold water, they can like feel it or something on their feet. So there's the bump, and you'll have to pardon the gigantic shirt because I'm lounging around the house today, just sort of chilling. Yeah, there it is. I've been told it's definitely a boy bump because it's so low and it's so different than my daughter's. My daughter's was not this way at all. She was very high up. The baby is like here, and their feet are up here, and their hands are down here. So that's where they are. Anyway, that's it. So, I guess I will talk to you guys next week, and I hope you all have a good one, and have a drink for me, because I could use one. Okay, bye.